And again, the big talker over the weekend and this morning is if President Trump will get out of the hospital today. There is some talk about him potentially being released from Walter Reed amid his coronavirus diagnosis. Let's go check in with our Jessica Alpern. She's live this morning from Florida Gulf Coast University, where she is expected to talk with a doctor about the president's state and his treatment there. Good morning, Jessica.
Yeah, good morning. That's right. So we do have a medical expert standing by here at FGCU. And specifically what we want to talk about are the treatments President Trump has been receiving while he has been in isolation and in care at Walter Reed Medical Center. So we're going to start by asking Robert Hawks about the steroid he received just over the weekend. So on Saturday, we know he received a dose of dexamethasone. So can you explain what that steroid is and what it's used for as far as treating those with COVID-19?
Sure. Good morning. So dexamethasone is a steroid. It's designed to reduce inflammation that with COVID-19 primarily happens in the lungs. So the small airways start to swell up. So dexamethasone will reduce the swelling, thereby making it easier for patients to breathe.
And so, Robert, one thing I want to ask you is we know that dexamethasone is one of a few treatments that President Trump has been receiving at Walter Reed. There has also been an experimental variety of other cocktails, some of which had to get emergency approval from the FDA. So can you also explain those cocktails he's receiving?
Sure. Some of the common ones, and I don't know exactly if he's received them all. One is remdesivir, which is an antiviral medication, which is supposed to stop the slow of COVID-19 from replicating, so to decrease the amount of virus in his body. The other one is a monoclonal antibody, which is a very experimental treatment at this point, which is designed to provide the immune system with kind of an extra boost to be able to fight COVID-19.
So from the steroid that he received on Saturday to these more experimental treatments, how risky are treatments like this?
So some of these medications are very new. They're experimental, so we really don't know some of the long-term effects of what they could be. But his physicians have determined that in the short term, it is better for his health in order to administer these, and then we'll look at the long-term, implications that can arise from that.
So one other thing I wanted to ask you about is there has been a focus on President Trump's dropping oxygen levels. So can you explain why it's so important to monitor this and what dropping oxygen levels means when you factor in the overall health of somebody with COVID-19?
Sure. A normal person has about 97-98% oxygen availability in their body. But with COVID-19, those numbers can drop to the low 90s, even to the high 80s. So certainly his physicians are looking at where are his oxygen levels, and if they drop too low, they'll need to give him supplemental oxygen to kind of increase the oxygen supply that's available to him.
So that's something we are going to keep a close eye on. Robert, thank you as always for the expert insight. I really appreciate it. You're going to want to stick with us because coming up later in the newscast, we're going to be joined by Robert once more, and we're going to be talking about what the president's quarantine process could look like if he does in fact leave Walter Reed today, what it could look like while he is transported back to the White House, and what his quarantine could look like inside of the White House. That's coming up later on in the newscast. For now, back to you.
All right, good information. Thanks, Jessica.